It's 2:47 a.m. and Grace's phone is ringing. Her 78-year-old mother just called, confused about her medications after the evening nurse visit. Grace dials the home health agency, expecting voicemail. But instead, a warm voice answers immediately. "Hi Grace, this is Nicole. I can see you're calling about your mother's care. How can I help you tonight?" Within 2 minutes, Grace has the answers she needs. Her mother's medication questions are resolved, and she hangs up feeling like agency truly cares. But here's what Grace doesn't know. She wasn't talking to a human at all. If you're running a home health agency, drowning in after-hour calls, staff burnout, and patients who miss appointments because nobody answered their questions, this changes everything. Today, I'll show you how agencies are using this technology to reduce no-shows by 35%, automate 90% of routine calls, and transform 2 a.m. emergencies into opportunities to wow families. And also what most homeowners get wrong about implementing this technology, but we'll get to that later. Let me start with a story that'll make you rethink everything about patient communication. Meet Jennifer Rodriguez, administrator at Sunshine Home Health in Tampa. 3 years ago, Jennifer was working 70-hour weeks. Her intake coordinator quit without notice. Patients were calling after hours with no one to help them, and their no-show rate was climbing towards 40%. Jennifer was considering closing the agency. Then, something interesting happened. Jennifer's teenage daughter was applying for colleges and kept getting instant responses from admissions offices through chatbots and virtual assistants. "Mom," she said, "why can't your patients get help like this?" That question led Jennifer down a rabbit hole that changed her agency forever. Think of patient communication like running a restaurant. In a traditional restaurant, you need a host, servers, busboys, and managers all working during business hours. But what if you had a magical server who never got tired, never called in sick, never mixed up orders, and could handle 10 tables at once, even at 3 a.m.? That server would transform your entire operation, wouldn't it? That's exactly what happened to Jennifer's agency when we helped them deploy their own AI voice agent. But how does a computer actually have a conversation that feels human? Picture your brain when someone talks to you. First, you hear the words. Then, you figure out what they mean. And then, you decide how to respond. Finally, you speak back. AI voice agents work the exact same way, but at lightning speed. When Mrs. Patterson calls to reschedule because she's feeling dizzy, the system hears reschedule and dizzy, understands she needs a different appointment time and might need medical attention. Then the system responds, "I'm sorry you're not feeling well, Mrs. Patterson. Let me reschedule your visit and also alert your nurse about the dizziness. Would tomorrow morning work better for you?" The magic isn't in the technology. It's in how natural it feels to patients who just need help. Now here's where Jennifer saw her first breakthrough. Remember those 40% no-shows that were killing Jennifer's revenue? 3 months after implementing AI voice reminders, that number dropped to 12%. But how did that even happen? See, the AI voice agent wasn't just calling patients saying, "You have an appointment tomorrow." Instead, it was having actual conversations. "Hi, Mrs. Chen. This is your health assistant calling about tomorrow's 10 a.m. visit with Nurse Maria. She'll be checking your wound care progress. Do you have any questions before she arrives?" When patients had concerns, they could voice them immediately. When they needed to reschedule, it happened instantly. No more phone tags and misconnections or forgotten appointments. Jennifer watched her scheduling coordinator go from frantically managing a daily crisis to actually having time for strategic work. It's like we hired a perfect employee who works 24/7 and never has a bad day, she told me. But the appointment reminders were just the beginning of Jennifer's transformation. You know, the most painful process where New referrals call you and your staff spends 45 minutes gathering information, insurance details, and scheduling first visits. Our AI agent turned that into a 3-minute conversation. Here's how it works. When Coastal Medical calls at 6 p.m. on a Friday about a new diabetic patient discharge, the AI voice agent answers immediately. Instead of leaving a voicemail and waiting until Monday, the referral source had a complete conversation right then. Patient information, insurance verification, first visit scheduled, and family notification sent. Done. By Monday morning, Jennifer's team had a new patient ready to start care instead of a voicemail to return. The numbers were staggering. Jennifer went from taking 2 to 3 days to process new referrals to having patients scheduled within hours. Her patient census grew by 30% in just 6 months. Not because she was getting more referrals, but because she wasn't losing them to delays and poor communication. But what impressed me the most was how this affected patient families. Remember Grace from our story in the beginning? She represents thousands of family members who call home health agencies after hours, scared, confused. Before AI voice agents, they got voicemail. Now, they get immediate help from systems that can access care plans, provide medication guidance, and escalate urgent situations to on-call nurses when needed. One evening, the AI voice agent at Jennifer's office took a call from a son whose father was showing confusion after a medication change. The system recognized this as a potential adverse reaction. Immediately, it paged the on-call nurse and stayed online to guide the family until human help arrived. The patient avoided an emergency room visit that could have been dangerous and expensive. Families tell us we're the only agency that actually answers when they need us. Jennifer said, they don't even know it's AI. And frankly, even if they know, I know they wouldn't even care if it is. They care about someone knowledgeable being there for them. This personal touch at scale is what separates agencies that thrive from those that struggle. Now, let me show you the financial impact that makes CFOs excited about this technology. Jennifer's agency saw their ROI within 90 days, but the return kept compounding. Fewer no-shows meant steadier revenue. Faster intake meant higher census. Better medication adherence meant fewer readmissions and complications that hurt quality scores. But the biggest surprise was staff retention. When nurses and coordinators aren't drowning in routine phone calls, they remember why they chose healthcare in the first place. Jennifer's turnover dropped from 35% to 8% in 1 year. In an industry facing massive staffing shortages, that's like striking gold. The compliance benefits were equally impressive. Every conversation gets logged automatically with perfect documentation. When surveyors ask about patient communication, Jennifer doesn't scramble through paper notes. She has time-stamped, searchable records of every interaction. We went from dreading compliance visits to welcoming them. She told me, our documentation is better than agencies 3 times our size. The technology handles the routine work so human staff can focus on skilled nursing care, complex case management, and building relationships that improve patient outcomes. Remember what I said about what most agency owners get wrong about implementing this technology? They think AI voice agents will make their service feel robotic and impersonal. The opposite is true. When your staff isn't buried in routine calls, they have more time for meaningful patient interactions. When families can get immediate answers at 2 a.m., they feel more supported, not less. The agencies implementing this technology now are creating competitive moats that their competitors can't easily cross. While others struggle with staffing shortages and operational chaos, forward-thinking agencies are scaling efficiently while improving patient satisfaction. Jennifer's story isn't unique also. Agencies across the country are discovering that the future of home health communication isn't about having more staff. It's about having smarter systems that amplify human expertise. By the way, do you know the #1 cause of nurse burnout and agency turnover? scheduling chaos. In the next video, I'll show you exactly how to build an automated system for real-time shift assignments and availability matching that cuts overtime costs by a proven 73%. Your nurses will thank you for it, and they might even stay.